Vitamin K, it's not actually a vaccine, it's a vitamin. It's a vitamin that our bodies make. But newborns, when they're first born, they just don't have enough. Their livers over time will make that. But there's a period of time, like Diet said, that these babies are at high risk for bleeding. And we worry about bleeding internally. We worry about brain bleeding and intestinal bleeding. And those babies that are not treated with a vitamin K are, again, at a high risk. And it's not usually in the first few days that they're in the hospital.
Hi, I'm Crystal Luce, Professor of Education.
And I'm Amy Ketchum, pediatric occupational therapist.
Welcome to Plant the Seed of Learning, the podcast where we merge education and medical models to bring you the science-based practical insights on all things early childhood.
Whether you're a parent, teacher, therapist, or policymaker, we're here to help you support children from the start.
Let's start off with a fact or fiction. If mom is healthy and does not have any conditions that can spread to baby, the baby does not need the hepatitis vaccine or erythromycin eye ointment at birth.
This is definitely fiction because even when a mother is healthy and has no infections, some risks can be seen or predicted, cannot be seen or predicted at birth. So we're going to talk a little bit more about these today, the importance of erythromycin eye ointment and the hepatitis B vaccine and why we use those. So today we are joined by some amazing NICU nurses. We have with us today Diet, Jasmine, and Kim, and we are so excited to have them join us. We also have a neonatologist, Dr. Philpo, and they will all be answering some questions about what it's like to have a baby in the NICU, how you might be able to best support a friend that has a baby in the NICU or a family member, and what is the deal with a lot of these baby medications and vaccines that are given right at birth. So we are so excited to have you all, and welcome to Plant the Seed of Learning.
Thank you for
Welcome.
having us.
Yes,
Sure.
thanks for having us.
We are so happy to have you talk about such important topics. According to the CDC, the rate of babies being admitted to the NICU has gone up 13% over the past 10 years. So this is a very timely topic to discuss today.
So let's get right in, jump right to it. I have a question. Can we start with you, Dr. Philpo? What are some of the most common reasons that babies might get admitted to the NICU?
Sure. So the NICU can definitely be a scary place, especially if you've never been there. And like Crystal said, that in the number of babies being admitted to the NICU has gone up, but also so has the number of deliveries and babies just being born. So the babies that come to the NICU are most likely either premature or have some condition that can't be handled in routine management out in the nursery. Those things can be respiratory distress or trouble breathing. They can have problems with their bilirubin and have a lot of jaundice that needs to be managed in the NICU. And other things like low blood sugar, different problems with temperature management. So some babies that are too small to stay warm on their own in the nursery, and other things like infection or congenital or birth defects or genetic defects that would need to be closely monitored in the NICU.
Thank you.
Ooh, that's very helpful. Kim, can you walk families through what the first 24 to 48 hours in the NICU often will look like emotionally and medically?
Yeah, so it's usually like some of the hardest times. You still have mom recovering from either a C-section or a vaginal delivery. So physically and emotionally, she is recovering herself. And just knowing that sometimes until the baby is medically stable, you can't always hold right away. The baby may not feed right away. Those are two things that parents really, want to do right away. They want to be able to hold their baby and feed their baby. So just knowing that sometimes that isn't able to happen as soon as possible, as soon as they would like, but we do try to get it to happen as soon as possible to encourage the kangaroo care, to have them be able to put their hands in there when they can, help with the things that they can, with diaper changes and positioning and things like that. They're going to learn a lot in that first 24 to 48 hours. So just helping them break down what they're learning, explaining every little thing that they're seeing, what we're using, why we're using it, helping them understand what the doctors are saying sometimes. Sometimes we have great physicians that explain things very clearly. And then other times they need a little bit help of breaking down what the doctor just explained to them. So just being there to help them with, all those aspects and stuff.
Kim, I love that. Can you expand a little bit on kangaroo care and what this exactly means?
Yeah, so kangaroo care is like just doing skin to skin. And it's not always just with the mom. We have dads that like to do it too. Although we do feel that the first time should be mom. We try to, and most dads are pretty respectful about that, letting mom do that first. But it really helps. It helps with mom's healing. It helps with the baby. It can lower um keep babies' temperatures more stable, their vitals more stable. It's good for their bonding. It's good for their milk production. So we try to get them to do that skin to skin as soon as possible. And when they're not in the NICU, it's immediate, within the first few minutes of life. So the NICU does hold that up a little bit, but it is our goal to get them there as soon as we can.
And that early bonding is so important, right? And data set shows us that it's not just preterm babies or babies in the NICU that benefit from that skin to skin. It's all newborn babies that really can benefit from that kangaroo care.
Yep. And moms, it makes moms very happy and
Yeah,
their milk supply.
that's
So
true. Definitely helps with breastfeeding as well. So, Jasmine, this question is for you. As you know, I had a baby in the NICU and it was not in my plan. I was very surprised that my daughter ended up in the NICU, and I hear that a lot from parents. This is just not the way I thought this was going to go. So, what would you say when NICU stays are unexpected? What are some realistic ways that families can mentally or practically prepare for the possibility of a NICU stay?
Yeah, we do come across that where there are times where, parents have a birth plan and they have what they think, how things are going to go, but that can change. So for those unexpected admissions, I think it's good to, look up information about common diagnoses that occur with newborns that Dr. Philpo had gone over, like low blood sugar, not being able to maintain temperature, high bilirubin. Those are respiratory distress. Those are common things we see with babies for those unexpected admissions that it can still happen. And looking into that, just so you're familiar with those topics before delivery. And just know that the baby will be in good care. I mean, the staff and healthcare team that will be looking after your baby, I hope it brings comfort to them that, they are trained for these scenarios. And we see those diagnoses, they're common for NICU babies. So we know how to take care of them. So they're in good hands. And, we're going to try to treat them as best we can and get them back to mom and dad as soon as we can.
That's so reassuring. Thank you.
I was just going to
So,
add to that. That's a
yeah,
huge thing, I think, in the first few days also is like getting that trust with the parents because it's a huge thing to leave your baby in somebody else's hands, especially in those first few days. So, like, we really try to earn their trust and make them feel comfortable and right away. So, that's something that just wanted
Exactly. And like Kim touched on before, we try to involve the parents as soon as we can because I think they feel like a loss of control when the baby's coming to the NICU. So
yes.
trying to involve them as soon as possible by doing the skin to skin, having them pump milk to provide milk for the baby because that's very good for the baby, and involving them in the assessments and care times. So
Mm,
allowing them to take the baby's temperature, if stable enough, and to do the diaper changes and involve them any way we can.
mm, so good. So, Diet, vitamin K has become one of the most debated newborn interventions. I see on social media a lot about this debate about vitamin K. And I think, we have a segment that we often do on our podcast. Is it viral or is it valid? And I think we all know that vitamin K is valid and very, very important for babies. But I'd love if you can explain a little bit to our listeners about what does the evidence tell us about vitamin K deficiency, bleeding, and what can happen if a baby does not receive that vitamin K.
Okay, yes. So vitamin K is a vaccine that we give to infants shortly after birth, within like the first couple hours. So vitamin K is a clotting factor, so it prevents bleeding. And also, when babies are born, they have like a low vitamin K in their system, so it does not transfer over to the placenta, and they don't have it in their gut. So that's why we give them the vitamin K. According to the CDC, they said it's very safe. I'm sorry, according to the CDC and American Academy of Pediatrics, it is safe. So if babies do not get vitamin K, they can get bruising in their face, they can have internal bleeding, they can also vomit blood, they can also pass the blood through their stools, and also through their umbilical cord can be bleeding. So again, if they don't get the vitamin K, it can be very
Dangerous.
critical.
Yeah.
Yes, very dangerous for the babies. They can end up in, of course, in the hospital or have blood transfusions and sometimes even death. And I know just recently, me, Kim, and Jasmine, um, I'm sorry. I know Kim, Jasmine, and myself, we did experience a baby that had the vitamin K deficiency. And it was pretty scary. So, but eventually she got 3 doses of the vitamin K and she recovered well.
Oh, thank you so much for sharing that. That is really a scary situation. And I think it's so important for parents to be educated and understand that. So thank you for sharing that.
Mhm.
Speaking of parent education, vaccines have been a hot topic everywhere lately. Kim, hepatitis B is often misunderstood because people associate it with adult behaviors. Why is the hepatitis B vaccine recommended at birth, and what risks does it protect infants from?
Yeah, so that's a good question because a lot of people do have a lot of, differences of opinion on the hepatitis B. It is we try to give it within the first 24 hours, if not the first 12 hours. Obviously, if a mom is affected with hepatitis B, we try to give it immediately, and then they also get like the Hep B immunoglobulin to help prevent them from getting it. But even on just babies that moms aren't positive for Hep B, we never know what our baby can encounter, right? What they're exposed to as a baby, as a child, as an adult. We hope that they're not going to live different lifestyles, but we never know what they're going to be exposed to. So hepatitis B is it's a liver disease, and it can affect your liver and damage it. It can cause it to have liver failure, liver cancer, and even death. So you can prevent that by getting vaccinated. And once you're vaccinated, it is a 3-course vaccine. You're vaccinated for life. So like that's it. It's going to protect you for life. Um, and you can get, some people think it's just dangerous lifestyle behaviors. You can get hepatitis B, needle sharing, sexual partners, things like that. But you can also get it from simple things like sharing a razor, sharing a toothbrush, things that some people don't really think that, can cause it. This isn't a risky behavior, but you can get it from things like that. Any just open contact with sores that you don't know, or you trust that maybe this person's okay and I'm helping them with something that's they're hurt on. And you can get it that way. Um, so it's just a way to protect your child now and for the rest of their life.
So important. So, Dr. Philpo, I'd love to have you weigh in here. We got some really great information from Kim and Diet about some of these vaccines, and I'd love to hear more about what you think about the growing misinformation on social media and that's out there that suggests that newborn medications are unnecessary or harmful. Anything else you want to share about vitamin K, hepatitis B, the erythromycin eye ointment, and any other vaccines that are given right after birth and why? If you can share a little more about that with us.
Of course. Yeah, we're fortunate to live in a time where we have information at our fingertips.
Yeah.
We have information, it's just an overload at times. but it can also hurt us because that information that we're getting and seeking isn't always correct. We saw this during COVID, where information was coming in constantly, and we didn't really know what to do with it. And it was day to day. We were making up new plans. We were learning about the science, learning about the management, and how to treat people with it. But we do know a lot more about how to treat babies, and we know a lot more about vaccines and what's been used for, almost 100 years now. So it's definitely, it's nice that we can get that information, but how do we sort out, what's right and what's not? And I think that's where it's important for, families and, as a patient to ask questions and to trust your healthcare team to answer some of those questions and alleviate some of those fears that you might have or might have heard on social media. And we're seeing a lot of that with vaccines. That's been the hot topic, and that's kind of moved into other areas that we see as more routine, or used to see as routine care, especially for our newborns. Vitamin K, it's not actually a vaccine; it's a vitamin. It's a vitamin that our bodies make. But newborns, when they're first born, they just don't have enough. Their livers over time will make that, but there's a period of time, like Diet said, that these babies are at high risk for bleeding. And we worry about bleeding internally. We worry about brain bleeding and intestinal bleeding. And those babies that are not treated with a vitamin K are, again, at a high risk. And it's not usually in the first few days that they're in the hospital. There are different phases of vitamin K deficiency, and it's usually the late form that can be anywhere from 2 weeks to 6 months that those babies are at higher risk and they're not in the hospital.
Yeah.
Those babies are at home and being managed or kind of monitored and cared for by their families. And that's a big worry for us because we're not there. And we're trained to see when things go wrong, but if we're not home with you, we can't always know that things are going wrong. So our goal is to really set everyone up for success and make sure everyone's leaving the hospital safely. And that's why vitamin K, even though there's a lot of question about, is it, do we need to give it? When do we give it? How do we give it? Those questions come up a lot. There is an oral form that we hear a lot about, and that is, it can be effective. It's not as effective as the injection. It also requires family or parents to really give this medication every week or every month, depending on what dose they're giving, and they can't skip doses, and they need to give all of the doses, and it won't even reach the same effectiveness as a single dose that these babies can get in the hospital. So there's a lot of information out there that we're still kind of helping in navigating with these families that have a lot of questions, and we're there to answer them.
Mm-hmm. Oh, so good, so important to share that information.
Yeah,
So,
and
yeah, go ahead.
I was just going to say, touch on hepatitis B as well.
Yeah.
Hepatitis B vaccine is also, again, it's a vaccine, and like Kim had said, that a lot of the transmission of hepatitis B in life is more through adult practices and when after childhood and even after the adolescent years. But it also, vaccines are the reason we give vaccines in the newborn period or start them and then continue through, the early childhood years, is because each dose of that vaccine adds to the effectiveness. So vaccines are injected to cause our bodies to make antibodies that protect us from infection. And each dose that we give over time, we get more and more of those antibodies. And that allows us to go on 30, 40 years without needing more vaccines. And so that newborn period, yes, babies aren't having those experiences that adults are, but if they do get hepatitis B during that period, that's a bad thing. That means that those babies are more likely, almost 90% of those babies infected in the newborn period with hepatitis B will have liver disease as an adult. They have liver failure, they can get liver cancer, versus finishing out the series of hepatitis B vaccines drops that down to about 10%. So you're preventing cancer with these medications in a
Wow.
way.
Yeah.
So it's not only are you thinking, oh, this is something that an adult, would need, but these babies are also at high risk if the chance were to happen. So we're protecting them, starting their first day on the earth, and protecting them through the rest of them. So it is very important that to note that the time period is important and not just what you hear about how it can be transmitted in other ways.
You explain that so well. And I think it's so important for parents and our listeners to hear that and have a good understanding of that. So thank you. So let's shift gears a little bit. Um, so I'm wondering, Diet, can you tell us if there's anything you would recommend to friends and family of parents with a baby in the NICU, to best support them during this time? This can be a very stressful time for families. So have you witnessed anything or have any families shared anything with you that they found particularly helpful and supportive?
Yes, so the NICU can be very stressful for families. I would suggest a family to find a support group, like a NICU support group. While they're in the NICU, like to journal like the baby's their day, how they're doing. Also, like journal for them, like how are they feeling in the NICU, and then later on they can look back at and read like all their notes and everything. Um, if you have family members out there that want to help you during this time, like they want to come over and clean for you, cook, or do anything to help you out, you should take that because in the end, it's really going to help you.
Yeah, don't say no to any help that's offered, right?
Oh, supporting parents is so important in so many facets.
Hardest job in the world.
It's very hard. Jasmine, what are some of the most common myths you hear from parents about newborn medications? And how do you respond to those concerns in a respectful way?
Yeah, well, as Dr. Philpo mentioned before, there is a lot of, conflicting narratives, in social media and in the general public,
Mhm.
things like hepatitis B causing autism, which there's not evidence that shows that. And just whether it's safe for babies or healthy. A lot of people are trying to have, natural births and, not give medications if the baby doesn't need it. Um, so for people who come in and who are still undecided at the point when they're coming to the NICU, our big job and role as nurses is education. That's a big part of our role. So if they're unsure, undecided, have any questions, we discuss the baby meds with them, and why it's recommended and safe for the babies. And we have informational sheets, that have education from reliable sources, so they can, get further detail. And then also, if they need to, if they still have more questions or want more details, they can talk to the providers. So the neonatologists are available to discuss that with them, to answer any questions or concerns.
That's excellent. Very helpful information. Babies in the NICU are so tiny. Oftentimes, I just can't get over the size. And I know it's so crucial to support families in the baby's development. Amy, when you're in there, what are some ways that you address this with families regarding the support of their baby's development in the NICU, even when they feel so scared and powerless?
It's funny. People are always so confused about why do babies need occupational therapy? Why would a 3 pound little baby need occupational therapy? They don't have a job. But I'm always telling parents, explaining to people the occupation of a baby is to stay regulated so they don't burn calories unnecessarily and to eat so they can go home. So a lot of what I do is feeding. So, we look at baby eating as their occupation at that time in their life. So I do a lot of feeding, a lot of parent education, and a lot of just helping to keep the baby regulated so that they're not like over reflexive and burning calories unnecessarily because we want them to store every single calorie they take in so they can gain weight and go home. So it's a lot of showing the parents how to keep the baby calm. When babies are born preterm or with any kind of condition, they're often very hypersensitive. So a bright light could be overstimulating, talking too loud, too much noise can be overstimulating, too much touch and movement can be overstimulating. So we try to just give them one sensation at a time. So if I'm talking to a baby, I might not move them too much. If we need the lights to be bright, we might not talk to the baby. So we really think about kind of modifying that amount of stimulation and then showing parents some strategies to help keep the baby calm. So looking for their signs of being overstimulated, like babies will have a lot of reflexes. Sometimes they'll hiccup excessively or yawn excessively, and that shows us they might be a little bit stressed out. They might stick their legs straight out and kind of bring their feet up and down like they're kicking in water. We call that walking on air. That's a sign that they could be stressed out. We could see their heart rates and respirations be going up and down. So we want to keep that all at an even keel. So the kangaroo care is great. We definitely do a lot of that. Before we can take the baby out of the NICU, we do what we call containment therapy, where I just show the parents how to put their hands on the baby and kind of gather them back into that fetal position so they feel that tight containment like they felt in the womb. We keep them swaddled. We have moms put a burp cloth or a little blanket inside their shirt while they're there, and then we put it in the isolette with the baby when mom leaves so that they are calmed by mom's scent. So there's a lot of ways that we use the baby's developing senses to keep them calm and keep them regulated. So that's some of the things that we do developmentally in the NICU. We also look at, starting to develop the bonding, and I keep a book at every bedside. So we really stress the importance of talking, reading, singing to babies. If baby's there for a while, we'll even start some vision therapy and play therapy. So it can really depend on how long the baby's in the NICU. But yeah, thanks for asking that, Crystal. I can talk about it all day long.
It's obvious there's so many things that you can do
Yeah.
for babies to support them and their families.
Yeah, exactly. So I'm wondering, for Dr. Philpo, are there questions that parents should feel empowered to ask about procedures, their care in the NICU, medications, without feeling like they're being difficult or, asking too many questions? How do you encourage parents to ask questions and make sure that they are informed?
Oh yes, yeah, definitely. It's when parents come to the hospital, whether before their baby's born, after, during, that's a period of time to learn about your baby and also learn as much as you can while you're there with us, as kind of these, we have the experience. No question is a bad question. And it's also important to stay open. So if you have questions about medications, you have questions about procedures, ask us. We're there to, we do this every day, and we know what could be best for your family and your baby. Sometimes the standard, medicine or procedure might not be the best for your baby, or maybe you have questions that, what's an alternative? And
Yeah,
we can discuss those.
yeah,
That's our, we're able to look at the big picture and say, okay, maybe let's try this instead because we know this could work in this situation. And it's always just stay open to, we're there to keep you safe. We're there to keep you and your baby safe, and to set you up for success. So no question is a bad question. You question everything, and we're there to give you those answers.
yes. I think that is such an important lesson for all parents, not just if their baby's in the NICU, to be an advocate for your baby. I had a friend, kind of a friend of a friend, that had a baby and called me and asked me to come to the hospital because their baby had a club foot and they didn't understand what that was, what was going to happen, what to do about that. And I said, well, what did the doctor say? And what did the nurses say? And they said, well, we didn't really want to bother them. We didn't really ask any questions.
Oh.
And it was just so interesting to me how timid they were, to reach out to their own nurse and doctor and ask questions about their baby's well-being. So I think that's great that you're empowering parents to, ask these questions and, find out what you need to know.
Yeah, you think of us all as a team. We're
Yeah.
all working together. We're not there to tell you this is how things are done, and vice versa. We're there to discuss the options and really work together
Yeah,
and be the best we can.
definitely.
And can I say something about that also, Amy?
Yeah.
Like I tell my parents all the time, like we're here to educate them. And if there's something that they don't understand, or maybe we may use some type of medical term that they don't know about, I always tell them, just say, look, pause. I need you to break it down to me to an easy way so I can understand. Because we want parents to understand what is going on with their baby.
Yes, excellent. Yeah, thank you.
Kim, what information do you wish every expectant parent understood before delivery about newborn care and the NICU realities?
I think a big one is that it's not, well, it might not always go exactly as planned. That's a big one. Having a birth plan and stuff is fine, and having an idea of how you want things to go and certain decisions made ahead of time is great. It's great to do your research and make certain decisions ahead of time. But no birth is the same. No delivery is the same. No child is the same. We have people all the time, parents are like, well, my last baby in the NICU. Well, they're all just like, we're all different humans. Babies are all different. So just kind of letting down some of those expectations that things may change. You may have to adapt to what's happening. A big thing that we get asked first time to come over to see the baby is how long is the baby going to be in here? And that is a really hard question because we never know. We always say it's really up to the baby, what's happening with the baby. Now, if we're doing something that we kind of can give a little bit of an estimate, but usually it's what's happening with the baby and just kind of going with the flow, learning that it is at the baby's pace. Kind of like what Dr. Philpo was saying too, like it's some things are golden standard. This is how we treat it, and this is what we do. And some things are like, let's trial and error. A lot of times that's what, feeding babies or different things and seeing how the babies react to that. And we don't always know. We have to work together as a team, the parents, what they're picking up on, what the nurses are picking up on, what the doctors are seeing to see what's best for that baby and what that baby needs. So just really just kind of, one, I think a big one too is asking your questions ahead of time if you can about certain things, about some of the vaccines or the medications. Your OB provider is a great person to talk to during those visits. And if they can't answer the questions, they can definitely send you in the right directions of where to look for those questions to be answered properly, with truthful information.
So good.
I love the connection to the OB doc because it is so true. You're in there repeatedly when you're pregnant, and that's a great time to ask those questions that you're concerned about. So you alleviate your stress, so you're not passing that stress on to baby.
Yeah,
Yeah, I think that's a big thing in general. Just, you have not everybody has 9 months, as we know, but you have several months leading up to it that when you're normally pregnant, and utilize that time when you're in the office. Ask your questions, do your planning, research your pediatrician. We have so many parents that come in and they're like, we don't know what we want. We don't know who we're going to use, as a follow-up. So it's like take the time to not just learn about the pregnancy, but what are we expecting after the pregnancy in those first few weeks and what we need to prepare for.
It's great advice. So, as we kind of wrap this up, we usually like to end our podcast with our guest giving a tip of what our listeners could try tomorrow. But since we're not all babies, we're not all having babies in the NICU tomorrow, I just wanted to ask you all to think about if parents remember just one thing from this conversation, about anything we talked about in the NICU or something we haven't talked about yet that you really want parents to know. Let's just kind of go around and each share one at a time what that might be, a sentence or two. Do you want to start, Dr. Philpo?
Sure. I think I said it earlier that, we are a team, that we're working together. And that if you leave with one thing from this, discussion, that again, you can trust us to have your best intentions, and your really they're our best intentions, and we have your back, and we all want everyone to be successful.
Great. Kim, do you want to go next?
Yeah, kind of the same as Dr. Philpo. Like we want parents to know that we not only are there for the baby, obviously that is our primary concern, But the other half of our job is for the parents. Like, we want to be there to support the parents the best we can in every aspect that we can. And hopefully they will put that trust in us and lean on us for that. And we'll just help them get through, every day that we can. And a lot of times, especially, I don't know, it's in every NICU, we have a small NICU, so they become part of the crew, part of the family. We become very attached to some of these parents.
Yes.
So just building that, relationship.
And it's fun to stay in touch with them and watch the children grow up, right? We love when they
Best
come back
part.
to visit.
It is the
Bring the
best part.
Yes,
Yes.
absolutely. Diet.
I agree with Kim. We want them to trust us, find some support group. Like Kim said, we're not only just taking care of the baby, but we also are taking care of the parents too. And we do build like really good bonds with some of our parents.
Yeah, thank you.
It's nice too sometimes to look at other parents. Sometimes we see parents bond with parents, either that are in the NICU at the same time, or parents that have gone through it before. There's a lot of parents have forums or different things that they've been a NICU mom. So let me, kind of help you through this. But being there, the people that are going through it and know exactly how you feel. Just wanted to add that.
Yes, love that. Thank you. Jasmine.
Yeah, kind of similar on the same lines that, we're patient advocates. So we are here to support them, answer any questions they have, further explain things. If they have any concerns, maybe they didn't agree with something with another healthcare, provider, they want something more explained, like we're there to support them. If they need more information or more details, we're happy to connect them with who they need to get more information. And also just kind of going back to what Kim was saying before about like length of stay, how that's the most popular question. Usually parents will say, how long do they have to be in here for, which we can't always give an answer, sometimes an estimation, depending on what is going on. But I always feel like a good question is more, what goals do I need? What does my baby need to do to discharge? So we kind of go over that with them, the baby
That's
needs
great.
to maintain their temperature and, not require heat. They have to have blood sugars within normal range. They have to be able to take their feeds, their full feeds all on their own. Breathe comfortably, not need respiratory support. So all those things. So we try to go over those goals that the babies need to reach so they know what the baby's working towards and milestones they need to hit before they can go home.
Oh, that's such a smart way to reframe that. Love that. Yeah.
It was such a pleasure to meet with all of you and see what fabulous teamwork you have inside the NICU. So we thank you for your time.
Yeah, I think we could also talk all day about our jobs.
Yeah,
You definitely could.
you could. Oh,
It's
well, we
great when you love
appreciate
your
it.
job.
Yes.
Yes, we do.
I think this is going to help a lot of listeners who might have that unexpected NICU stay or have a family member that has that. So, thank you all so very much for being a part of this podcast today. We really appreciate having you.
Thank you.
Thank
Thank you,
you.
guys.
Bye.